Hi, I'm Dr. Roger Levin, Chairman and CEO of Levin Group, the leading and largest dental practice management consulting firm. For the last few months, I've been doing a lot of research for my book called The New Rules of Increasing Practice Production. When the recession hit, Levin Group spent extensive time looking at all the ways practices could increase production since the majority of practices had declined in their production numbers. One of the ways we actually found was doing a better exam of the new patient. Now, in other videos, I've talked about the concept of the brand new patient phone call that creates value, confidence, and trust. I've also talked about the new patient orientation that almost no practices do that welcome a new patient into the practice, furthering that feeling of value, confidence, and trust. All of this leads to case acceptance once it is presented. One of the points I make is that if you're bringing your new patients in through hygiene, you will be at 33% the production of where you could be if you bring new patients in on the doctor's schedule if they're over the age of 30. And the reason is that doctors tend to go into the hygiene room, do relatively quick exams, and after that exam move out of the hygiene room, only seeing and recommending the most obvious treatment. But when a doctor spends time getting to know a patient, doing a complete exam, what we call the 5-phase exam, then that doctor and patient have a better rapport, they bond, and more case acceptance takes place. One phase of the 5-phase exam is the tooth-by-tooth exam. Now, I'm a dentist, and many of you watching this are dentists as well. And we believe that we do an excellent tooth exam. The truth is that when we see a new patient in hygiene, we're doing more of a cursory tooth exam. The tooth-by-tooth exam is looking at every tooth, every restoration, every crown, every bridge, every partial, every denture, every veneer, every composite. I could go on. And the point is that we have to look at the periodontal situation and analyze each tooth fully. There are so many restorations today that need to be redone. There are restorations that could be more aesthetic. There are better options than some of the restorations we see in the mouths of new patients today. All of these need to be diagnosed. The patient needs to be educated. They need to be discussed. And you'll be amazed with the right value, confidence, and trust how many patients want to take advantage of a better opportunity in dentistry and for each of their teeth.